New arthritis treatments in 2026. Hope for osteoarthritis. Patients, Part 1. Have you ever been told that if you have osteoarthritis, your only options are to live with the pain, take painkillers, or eventually replace the joint? For millions of people around the world, that has been the reality for years. Osteoarthritis has long been considered a disease that simply gets worse over time. Once the protective cartilage inside your joints wears away, doctors have traditionally focused on managing symptoms rather than reversing the damage. But what if that way of thinking is beginning to change? What if researchers are now exploring treatments that don't just reduce pain, but may actually help protect, repair, or even regenerate damaged joint tissue? Today, we're diving into some of the most exciting arthritis breakthroughs emerging in 2026. These new therapies are giving scientists, doctors, and patients fresh reasons for optimism. While most of these treatments are still being studied and aren't miracle cures, they represent a significant shift in how osteoarthritis may be managed in the years ahead. If you or someone you love struggles with aching knees, stiff hips, painful hands, or other symptoms of osteoarthritis, you'll want to stay with us until the very end. Some of these innovations could completely reshape the future of arthritis care. Welcome back to My Emerald Health, where we bring you trusted, evidence-based health information in simple language to help you make informed decisions about your well-being. If you're passionate about living a healthier, longer, and more active life, don't forget to subscribe and turn on notifications so you never miss one of our videos. Now, let's begin. For decades, osteoarthritis has been one of the most common causes of disability worldwide. According to the World Health Organization, more than 500 million people globally live with osteoarthritis, making it one of the leading causes of chronic pain and reduced mobility. As populations age and obesity rates increase, that number is expected to continue climbing. Unlike rheumatoid arthritis, which is an autoimmune disease, osteoarthritis develops when the cartilage that cushions the ends of bones gradually breaks down. Without that smooth, protective layer, bones begin rubbing against each other. Over time, this causes pain, swelling, stiffness, reduced flexibility, and difficulty performing everyday activities. Many people notice symptoms gradually. They may first feel discomfort after climbing stairs, standing for long periods, or exercising. Later, even simple activities like walking, gardening, or getting out of a chair become painful. For years, treatment options have remained relatively limited. Doctors have typically recommended weight loss for overweight patients, regular low-impact exercise, physical therapy, anti-inflammatory medications, joint injections, braces, walking aids, and eventually joint replacement surgery when symptoms become severe. These treatments certainly help many people improve their quality of life. However, one major problem has remained. Most of them do not stop the disease itself. Instead, they mainly reduce symptoms while the underlying cartilage continues to deteriorate. This is exactly why scientists around the world have been searching for something better. And now, researchers believe they may finally be entering a new era. One of the biggest changes happening in arthritis research today is a shift away from simply treating pain toward trying to preserve or even restore the joint itself. Instead of asking, how can we reduce pain, researchers are increasingly asking, how can we keep cartilage healthy before it's too late? That may sound like a small difference, but it changes everything. Think of your knee like the tires on your car. If the tires begin wearing out, taking pain medication won't stop the rubber from disappearing. You need something that protects or rebuilds the tire. Scientists are now trying to do something similar with human cartilage. Several research teams are exploring treatments that encourage cartilage cells to repair themselves, reduce inflammation inside the joint, and slow the progression of osteoarthritis. While these treatments remain under investigation, the early findings have generated tremendous excitement. One of the most talked about breakthroughs in 2026 involves regenerative medicine. Regenerative medicine focuses on helping the body repair damaged tissues using biological processes rather than simply masking symptoms. Among the most promising areas are cell-based therapies. Researchers are studying different types of cells that naturally produce molecules capable of reducing inflammation and supporting tissue repair. One approach involves mesenchymal stromal cells, often called MSCs. These cells have attracted attention because they release substances that may help calm inflammation while encouraging damaged tissues to heal. Clinical studies have suggested that some patients receiving these therapies experience improvements in pain and joint function. However, researchers emphasize that results have varied between studies, and larger clinical trials are still needed before these treatments become standard medical practice. That distinction is extremely important. While some private clinics advertise stem cell treatments as guaranteed cures, major medical organizations continue to urge caution because many commercial therapies have not yet been proven effective or approved for routine use. So, while regenerative medicine holds exciting promise, patients should always discuss any treatment with qualified healthcare professionals rather than relying on marketing claims. Another fascinating breakthrough involves tiny biological messengers known as extracellular vesicles, sometimes called exosomes. These microscopic particles are naturally released by cells throughout the body. Scientists have discovered that they carry proteins, genetic material, and signaling molecules that help cells communicate with one another. Why does this matter? Because healthy communication between cells plays an important role in healing. Researchers are investigating whether specially prepared extracellular vesicles can reduce inflammation, encourage cartilage repair, and improve joint health. Laboratory studies and early clinical research have produced encouraging results. Scientists believe these tiny particles may eventually become safer and more targeted alternatives to some existing regenerative therapies. However, just like stem cell research, much more evidence is still needed before widespread clinical use becomes possible. One of the most exciting developments reported this year comes from researchers working on injectable treatments designed to remain inside the joint for extended periods. Traditional corticosteroid injections often provide temporary relief, but usually wear off after several weeks or months. New experimental injectable materials are being designed to stay active much longer while supporting healing inside the joint. Some research teams are developing specialized hydrogels that slowly release healing molecules over time. Others are creating injectable biomaterials that act almost like temporary scaffolds, giving damaged cartilage a better environment in which to repair itself. Imagine placing fresh soil around a struggling plant instead of simply watering it. That's a simplified way to think about what these materials may eventually accomplish inside damaged joints. While still experimental, these technologies represent one of the fastest growing areas in orthopedic medicine. Another major area receiving enormous attention involves reducing inflammation in smarter ways. For years, doctors have relied heavily on NSAIDs, or non-steroidal anti-inflammatory drugs, to help manage arthritis pain. While effective for many people, long-term use can increase the risk of stomach ulcers, kidney problems, and cardiovascular complications in some individuals. Researchers are therefore searching for treatments that target inflammation much more precisely. Instead of affecting the entire body, newer medications aim to block specific inflammatory pathways inside affected joints. This targeted approach could potentially provide relief while reducing unwanted side effects. Several promising compounds are currently progressing through different stages of clinical testing around the world. Although not all will succeed, experts believe this precision-based strategy represents an important direction for future arthritis care. One thing becoming increasingly clear is that osteoarthritis is far more complex than doctors once believed. Years ago, it was often described simply as wear and tear. Today, scientists know that's only part of the story. Inflammation, genetics, metabolism, obesity, previous injuries, muscle weakness, and even the health of surrounding tissues all contribute to how osteoarthritis develops. This deeper understanding is helping researchers design treatments that address multiple causes rather than focusing on cartilage alone. And that may ultimately produce better long-term outcomes for patients. Perhaps the most encouraging message emerging from current research is this: hope is growing, not because scientists have discovered a miracle cure, but because they're finally beginning to understand the disease itself much more clearly. Every major advance in medicine starts with understanding how a disease works. Once researchers understand the mechanisms, better treatments usually follow. That appears to be exactly what's happening with osteoarthritis today. But here's something that completely changed the way scientists think about osteoarthritis. For decades, doctors described it as a simple wear and tear disease. The idea was straightforward. As we age, our joints gradually wear out, just like the tires on a car. Today, researchers know that explanation is far too simple. Osteoarthritis isn't just about aging cartilage. It's a disease involving the entire joint. The cartilage, the bone beneath it, the joint lining, surrounding muscles, ligaments, and even the immune system all play important roles. That's one reason finding a cure has been so difficult. Think about it this way. If the engine, brakes, tires, and steering of a car are all damaged at the same time, replacing just one part won't solve the whole problem. The same is true for your joints. Scientists now believe osteoarthritis develops differently from one person to another. Someone who develops arthritis after a sports injury may have a very different disease process from someone whose arthritis is linked to obesity or aging. That discovery is changing everything. Instead of searching for one treatment that works for everyone, researchers are beginning to design therapies tailored to different types of patients. This is known as personalized medicine, and many experts believe it represents the future of arthritis care. But that leads to an even bigger question. If scientists finally understand what's happening inside our joints, what exactly are they doing about it? Can damaged cartilage actually be repaired? Are stem cells really as promising as the headlines claim? Could scientists eventually grow brand new cartilage inside the body? Those are exactly the questions we'll answer in part 2. Some of the breakthroughs you're about to hear sound almost unbelievable, but they're based on real scientific research happening right now. If you don't want to miss it, subscribe to My Emerald Health, and I'll see you in part 2. And in the next part of this video, we'll explore some of the newest medications, breakthrough clinical trials, cartilage regeneration technologies, and one remarkable treatment that has scientists wondering whether damaged joints may someday heal in ways previously thought impossible. You won't want to miss it.